Let us see what is epidemiology. Epidemiology is nothing but the study of health and disease in populations and how these studies are influenced by heredity, biology, physical environment, and personal behavior. And the father of epidemiology is John Snow. This is the actual definition of epidemiology given by John M. Last in 1988, and he defined it as the study of distribution and determinants of health related states or events in a specified population and the application of this study to control health problems. And basically, there are three aims of epidemiology. The first one is to describe the size and distribution of the disease and to provide the data essential for planning, implementation, and evaluation of health services for the prevention, control, and treatment of diseases. And finally, to identify the etiological factors in the pathogenesis of the disease. And the basic principles of epidemiology includes exact observation, correct interpretation, scientific construction, and rational explanation. The tools of epidemiology includes rate, ratio, and proportion. What is rate? It is nothing but the frequency of a disease or characteristics expressed per unit size of the population or group in which it is observed. And here there is a formula given which is nothing but the number of events, that is the death or disease in a specific period, and which is divided by the population at risk of experiencing the event or disease into 10n. And the ratio is nothing but the relation in size between two random variables, two random quantities. In ratio, the numerator is not the part of the denominator. And hope you all know it is usually expressed as A is to B or A divided. And the proportion is nothing but the ratio which expresses the relation in magnitude of a part of the whole and is usually expressed in percentage. And the formula is, the example is given as the number of school children with caries at a certain time period divided by total number of the children in the school at the same time into 100. This into 100 is very important. And you should know about what is incidence and what is prevalence about epidemiology. And incidence is nothing but the number of new cases of a specific disease occurring in a defined population during a specified period of time, and the formula is given down. And the prevalence is nothing but both the old and the new cases, which is usually expressed as a percentage. And there are two types of prevalence: point prevalence and period prevalence. And the basic types of epidemiology includes descriptive epidemiology, analytical epidemiology, experimental epidemiology. And I have given the definitions of descriptive, analytical, and experimental epidemiologies. Kindly go through. And the uses of epidemiology includes community diagnosis, rise and fall of a disease, planning and evaluation, evaluation of individuals' risk and chances, syndromes identification, and risk factors is also identified, completing the natural history of the. And how about the diagnosis? Diagnosis is very important because to identify individuals with the disease, it is useful and important for epidemiologists to study disease in populations or for clinicians to take care for individual patients. And it also could lead to invalid conclusions about the association between a disease and some exposure or characteristic, and misdiagnosis could mean that the persons without the disease would face the costs and risk of unnecessary treatment. And what is epidemiological triad? Epidemiological triad includes, triad means three things are included. What are the three things? The first one is host, the second one is the agent, and the third one is the environment. So a disease is related to these three things. So epidemiological triad is very important, and here we tabulated the host, agent, and environment. Kindly go through. And that is all about epidemiology. And moving on to epidemiology of gingival and periodontal diseases. To a better understanding of gingival and periodontal diseases, we should know about indices first. What is an index? An index has been defined as a numerical value describing the relative status of a population on a graduated scale with definite upper and lower limits, which is designed to permit and facilitate comparison with other populations, classified by the same criteria and methods. And the following are the objectives of an. And I have tabulated you some of the plug indices, calculus indices, and bleeding indices. Here are the oral hygiene indexes I have given, and out of these, the oral hygiene index simplified, given by John Green and Vermeulen, are very important. And patient hygiene performance index, plug component of the periodontal index given by Ramford, is also important. And plug index given by Silness and Low is also very important. And kindly go through these indices also. And moving on to calculus indices, calculus surface index, calculus surface severity index, calculus component of the OHIS given by Green and Vermeulen are the very important indices that you should know. And calculus component of the periodontal disease index given by Ramford is also important. And these are all the indices used to assess gingival inflammation. Those are papillary marginal attachment index, papillary marginal index, gingival indices given by Lowensilness and Ramford. And moving on to indices used for assessment of gingival bleeding, this includes sulcus bleeding index, papillary bleeding index, Eastman interdental bleeding index, gingival bleeding index given by Ainamo and Bay, bleeding point index, and modified sulcular bleeding index. Out of these indices, sulcular bleeding index, papillary bleeding index, and the gingival bleeding index given by Ainamo and Bay is very important. And moving on to indices used for assessment of periodontal diseases, periodontal index given by Russell, periodontal disease index given by Rumford, and extent and severity index given by Carlos, gingival recession index by Morris are very important indices regarding the periodontal disease index. And the fluorosis index are tabulated, you just go through. Out of these, community fluorosis index is very important. And here are the indices used for treatment needs assessment. Community periodontal index of treatment needs given by Ainamo is very important. This is given by WHO, and you have to go through it thoroughly. And one more index is there to assess the bone, which is nothing but the gingival bone count. And moving on to gingival diseases, what is gingivitis? This is nothing but the inflammation of the gingiva in which the junctional epithelium remains attached to the tooth at its original level. How do you measure gingival diseases? So, gingivitis is measured by gingival indices. So, gingival indices are basically two methods. There are two methods for assessing the presence and extent of gingivitis. One is grading the inflammation according to how many gingival units are judged to be inflamed, and the second one is grading the inflammation according to the qualitative changes that are observed in the gingival tissues. And moving on to oral hygiene index given by John Green and Vermeulen. This is very important. See how the quadrants are made. The segments of tooth are given. There are 6 segments. The segment 1 is shown in the diagram. You see it includes the molars and premolars of one side, and segment 2 is anteriors, that is from canine to canine, and segment 3 is again from premolars to molars in the upper arch. Then coming on to the lower arch, it includes molars to premolars again, and again the lower anteriors from canine to canine as segment 5, and segment 6 is from premolars to molar. In the oral hygiene index, the debris and calculus are calculated separately. Now we'll see about the debris score. See the picture. 0 is nothing but no debris or stain present. One is soft debris covering not more than 1/3 of the tooth surface or the presence of extrinsic strains regardless of surface area covered above. And the 2 is soft debris covering more than 1/3 but not more than 2/3. And 3 is soft debris covering more than 2/3 of the exposed surface. And the calculus score again is 0 is no calculus, 1 is supragingival calculus not more than 1/3 of the tooth surface, 2 is supragingival covering more than 1/3 but not more than 2/3 of the exposed tooth surface, 3 is supragingival calculus covering more than 2/3 of the exposed tooth surface or a continuous heavy band of subgingival calculus. So how do you calculate the index? Debris score index is given separately and calculus index is given separately. And debris index is total debris score recorded by number of segments scored, and calculus is total calculus score recorded by number of segments scored. And here the range is given from minimum it is 0, maximum it is, and these are all the limitations. And moving on to oral hygiene index simplified. We have seen just now we have seen about the oral hygiene index, and oral hygiene index simplified is different from oral hygiene index. In what way it differs? It differs in two ways. One is the number of tooth surfaces scored alone is calculated here, and the method of selecting the surfaces to be scored. And the values are from 0 to 3 in the oral hygiene index. In the oral hygiene simplified index, it is from 0 to 6. Moving on to gingival index. Actually, in cases of gingivitis, we have to assess bleeding, which is very important to assess a disease. The gingival index was first proposed in 1963. And how do you assess bleeding in this? Bleeding is assessed by running a periodontal probe along the soft tissue wall of the gingival crevice. And the gingival score is total score divided by number of teeth. And this is the scoring criteria for gingival index, which is 0 is normal gingiva, 1 is mild inflammation, 2 is moderate inflammation, and 3 is severe. And next index is modified gingival index. What is modified gingival index? Just now we have seen about the gingival index. In what way it differed from gingival index we are going to see. There in gingival index 0 is not included. That is absence of inflammation. 0 is absence of inflammation, and mild inflammation is splitted into 2 here. Score 1 and 2 here. There only one mild inflammation was given. Mild inflammation is score number 1 is slight change in color, little change in texture of any portion of but not the entire marginal or papillary gingival unit, and the score 2 is mild inflammation criteria as above but involving the entire marginal or papillary gingival unit. And what is gingival bleeding index? Gingival bleeding indices are used in clinical practice, surveys of population groups, and clinical trials of anti-plaque or anti-gingivitis agents. And this is a protocol for assessment of gingival bleeding index. And moving on to plaque index, which is given by Silness and Lowe, is very important. They may ask you in exams. This index assesses only the thickness of the plaque at the gingival area of the tooth. The surfaces examined are the 4 gingival areas of the tooth. That is the distofacial, facial, mesiofacial, and lingual. And the teeth assessed are 1, 6, 1, 2, 2, 4, 4, 4, 3, 2, and 3, 6. Kindly remember it. And the scoring criteria is 0 is no plaque in the gingival area, 1 is a film of plaque adhering to the free gingival margin and adjacent area of the tooth, and 2 is moderate accumulation of soft deposits within the gingival pocket, and 3 is abundant of soft matter within the gingival pocket and or the gingival margin and adjacent tooth surface, and the rating is given below. Now we'll see the distribution of gingivitis in different areas of the mouth. It is given in the table. Kindly go through. And the surfaces, which surfaces are affected first and which surfaces are affected next. Regarding the facial surface, upper first and second molar are affected first, followed by lower anteriors, upper anteriors, upper premolars, lower first and second molars, lower premolars. And above the lingual surfaces, lower first and second molars are affected first, followed by lower premolar, lower anteriors, upper first and second molars, upper premolars, and upper anteriors. What is periodontitis? Periodontitis is nothing but inflammation of the periodontium that extends beyond the gingiva and produces destruction of the connective tissue attachment of the teeth. It exists in three forms, that is chronic periodontitis, aggressive periodontitis, and periodontitis as a manifestation of systemic diseases. But now aggressive periodontitis is not taken into account. Chronic periodontitis is the most common. How periodontitis is measured? There are various indices. Here we are going to see about the periodontal index and the periodontal disease index. The periodontal index was first developed by Russell in 1956, and the scoring criteria is from 0 to 8. 0 is negative, that is there is no overt inflammation in the investing tissue nor loss of function. 1 is mild gingivitis, 2 is 4 is onset of periodontitis. So here in 4 only you are getting periodontitis. And 6 is gingivitis with pocket formation. 8 is advanced destruction with loss of masticatory function. And the rule is, when you have a doubt in assessing, you should choose the lesser score. Periodontal index per person is equal to sum of the individual scores divided by number of teeth present. And here I have given you the clinical conditions and scores. And these are all the uses and advantages of periodontal. How about periodontal disease index? Okay, here two aspects of the disease are often used, that is the selection of the 6 Rumford tooth teeth and method for measuring pocket depth, and loss of periodontal attachment related to the cemento-enamel junction. The index teeth are 16, 21, 24, 44, 42 and 36. And this is the scoring criteria. 0 is absence of inflammation. 1 is mild to moderate inflammatory gingival changes. 2 is mild to moderate gingivitis in extending all around the tooth. 3 is severe gingivitis. 4 is gingival crevice in any of the 4 measured areas apically to the CEJ but not more than 3 mm. 5 is gingival crevice extending apically to the CEJ 3 to 6 mm, and 6 is gingival crevice extending apically more than 6 mm from the CEJ. And next one is the community periodontal index of treatment needs. This is very important, was given by WHO and FDI, and the CPITN is a probe designed that has been frequently in periodontal epidemiology during the last decade. The index teeth are examined and a single score is given for each tooth. And this is the probe. It is a color-coded probe, WHO color-coded periodontal probe for assessment of probing pocket depths around either all the teeth or all the WHO designated indexed teeth. And you can appreciate the color coding. I have given you a segment of this. There is a ball-ended 0.5 mm tip and 3.5 to 4.4, sorry, 3.5 to 5.5, there is a color coding. Okay. Now you can go through that and the code and it is the codes are given. Code 0 is no treatment. Code 1 is improving the personal hygiene. Code 2 or 3 need for professional cleaning. Code 4 is complex treatment which involves deep scaling, root planing and more complex surgical procedures. These are all the treatment needs. Treatment need number 0, 1, 2 and 3. TN denotes treatment needs. And how about the prevalence of periodontal diseases? The old model of periodontal diseases described earlier held that susceptibility to periodontal diseases was virtually universal. What epidemiology has demonstrated is that the majority of just about any adult population has chronic periodontitis to some degree, but that mild attachment loss as measured by CAL of 2 mm or so is compatible with good health and function for many years. And the host response is now seen as a key factor. So I have told you already, host, agent and environment are the triad of epidemiology. The host response is now seen as a key factor in the clinical expression of periodontitis, with only some 20% of periodontal diseases now attributed to bacterial variation. Some 50% of periodontal diseases have been attributed to genetic variants and more than 20% to tobacco use. And that was about the prevalence. And what about the incidence of periodontitis? I have already told you about the difference between incidence and prevalence. Incidence is number of new cases and prevalence is both old and the new cases. In periodontitis, incidence is often taken to mean new sites that meet a definition of periodontitis, even if these occur in people who already have other diseased sites. And finally, these are the things which you should know definitely. They are the risk markers or the predictors, risk indicators, and risk determinants. What are risk markers or predictors? These are associated with increased risk for disease but do not cause the disease. These factors are identified in cross-sectional and longitudinal studies. A risk factor that can be used to predict the future course of disease is known as a risk marker. Risk indicators are probable or putative risk factors that have been identified in cross-sectional studies. And the risk determinants are defined as those risk factors that cannot be modified. And I have listed out the risk factors, risk determinants, risk indicators, and risk markers. Risk factors are nothing but tobacco smoking, diabetic patients, pathogenic bacteria, and tooth deposits. And the risk determinants are genetic factors, age, gender, socio-economic status, and stress. Here, risk indicators are patients with HIV, osteoporosis, infrequent dental visits, and the risk markers are previous history of periodontal disease patients and bleeding on probing. That is all about this. Kindly go through the PPT carefully and answer the questions I have given you in the assignment and post the answers tomorrow. Thank you.